And let's go back into coronavirus coverage now. And the FDA Advisory Committee is recommending booster shots for various groups. There are a lot of questions about that third dose of Pfizer, Moderna, and Johnson & Johnson shots. Dr. John Whyte is the Chief Medical Director of WebMD, and he's joining us now to talk more about the guidance. Thanks for joining us.
Good morning. It's great to be with you again.
But let's talk about these boosters. Where do we stand? Who can get one right now, and who is in the running for it later on down the line?
So right now, anyone that's immunocompromised, they've been eligible for both Pfizer or Moderna as a booster. That occurred a few months ago. Pfizer, those folks who got Pfizer who are 65 years of age or older, who are older than 18 and have underlying health conditions, or involved in occupations such as grocery store workers, clinicians, and the healthcare community, they also are eligible, and they've already been getting boosters. Now, if you got Moderna, we're still waiting for a final decision. That's going to mirror, I think, exactly the same population as Pfizer. But here's an important point. It's half the dose. And that's probably because Pfizer was not as strong probably as Moderna. Moderna's probably been a little more intense of an immune response. So I expect that we'll hear more on that this week. The CDC is supposed to meet Wednesday or Thursday. And then J&J, this is where it gets confusing.
Right.
That's for anyone that got the Johnson & Johnson vaccine, 18 years of age and older, about 15 million people. You probably should be ready to get a boost if you've gotten the J&J vaccine. There's not going to be any caveats about age or underlying conditions or occupation. That's for anyone.
Some of my friends who got Pfizer are looking at Moderna's efficacy numbers. And they're like, well, I want some of that Moderna. What are your thoughts on the mixing and matching of it?
Yeah, I think the mixing and matching is more if you got the Johnson & Johnson vaccine and maybe get Pfizer or Moderna. I got the Moderna, so I'm sticking with what I got. I think if you got Pfizer, they're pretty much the same vaccine, Pfizer and Moderna. So I'd stick with that, especially since Moderna is going to be half the dose. The J&J, though, in terms of mixing and matching, you might get a 4 times immune response from a boost from J&J. But for Pfizer, you're getting a 35 times increase in immune protection in terms of the number of antibodies. With Moderna, you're getting 70 times. So you really want to think about having a discussion with your doctor about maybe mixing and matching. There's no recommendation about it, but we're seeing some real-world evidence in practice around the world of some benefit to that.
We have about a minute left. May I ask you your thoughts on the passing of Colin Powell? His family came out with a statement today saying he had COVID complications. NBC News is also reporting he was dealing with blood cancer, and he was 84 years old. What are some of the things that people should be hearing from all of those scenarios interacting at once?
Yeah, and really my condolences to the Powell family. What a great American. What you have to remember is usually we don't hear about the underlying health conditions, but they've announced that because they wanted to know that. So here he was battling multiple myeloma, a blood cancer, which compromises your immune system. He had Parkinson's disease, which also puts you at increased risk. So even though he was fully vaccinated, he probably had less of an immune response and still had protection. But, sadly, coronavirus likely overwhelmed his immune system. And I think they put that out there because they don't want people to think that you shouldn't get vaccinated. He got vaccinated. He did all the right things. But unfortunately, sometimes your health conditions can work against you.
Very true. All right, Dr. Whyte, thank you so much for joining us.